Good day everyone, I'm Christian Kim Gomez and today our group will be reporting about routine handling and care of horses. Basic health care. Number 1 is feeding your horse. Horses must have access to an adequate amount of good quality feed in the form of pasture, roughage or hay or chaff. You need this kind of feed to keep your horses in good body condition, and here's a guide to the amount of feed is generally 1 to 2 kilograms per 100 kilograms of body weight each day, or for example for the pony measuring up to 13.5 hands and its weight is 200 to 350 kilograms, so you feed 3.3 to 7 kilogram each day. And next is Galloway measuring 13.5 to 13.5 to 15 hands and weight is 350 to 500 kilograms, so you need to feed the Galloway to 7 to 10 kilograms each day. Next is the horse measuring 15 to 16.5 hands and the weight is 500 to 650 kilograms, and you need to feed the horse about 10 to 13 kilograms each day. And the last one is the heavy horse measuring 16.5 plus hands and the weight is 650 plus kilograms, so you need to feed the heavy horse 13 plus kilograms each day. You may need to supplementary feed if a horse is being worked regularly, there is not enough pasture, and the horse is losing body condition. You may also provide a salt lick or mineral block in the paddock. As you can see in the picture, the first picture is the salt lick and the second picture is the mineral block. And you may also consult a veterinarian about suitable feeds or grass clippings, because many food scraps are not suitable feed as they can cause a horse become ill. Second one is water for your horse. As a guide, a horse may drink 25 to 45 liters per day in hot weather. Clean water must always be available for your horse to avoid colic, dehydration, and death. And here are the things or containers that you can use. Number 1 example is dam or self-filling trough. Best but should be checked frequently. The second example is bathtubs, must be checked daily and refilled if needed. And the last example is buckets, not suitable as a permanent water supply because it can be tipped over, but some horses prefer to drink from a bucket of water rather than from a waterer. Therefore, you should hang a bucket full of water in the stall overnight, and the flat back of water buckets allows them to be placed flat against the stall wall so that they stay in place and do not swing around while the horse is drinking. The third one is shelter for your horse. Horses need shelter from sun, wind, inclement weather, and also if they are injured or sick. And here are the example for the suitable horse shelters. First example is trees. Trees provide protection from the sun, and they are also natural air conditioners for horse. The second example is walk-in shed, so that horse can shelter anytime they want, and also protection from wind, rain, and snow depending on the season. The third example is stable. The horse stable is almost as cold as outside, but it offers straw bedding, feed, fresh water, and protection from the chilling wind or the snow. The stable is also a comforting place for many horses where they know they are safe. And the last example is a waterproof rug. A waterproof rug can protect the horse from cold weather, but check daily to ensure it is not rubbing, slipping, or leaking. And also, not all horses will need a stable or housing. Some breeds with thick coats are capable of living outdoors throughout the year, provided they can get shelter from prevailing winds, summer sun, and flies. Also, some horses do not like being on a stable for too long because it can make the horse stress when kept in isolation.
Exercise and space for your horse. Horses must have enough space to walk and run around unless they are exercised daily. Stabled horses must have enough space to walk forward, turn around, lie down, and roll. Sleek horses may need to be confined under the directions of a veterinarian. Horses must not be tethered long term. It is only acceptable for a short period of time. When tethered, the following requirements must be met: access to water all the time, exercise off tether daily, ability to lie down and stand without restriction. Tether must be attached by a swivel to a collar or halter. Twice daily inspection. Access to shelter at all times. For horses, this may be shelter from a tree as well as the physical shelter. Be able to graze freely. Paddocks for your horse. To prevent injury and escape of horses. Keep fences in good repair. Prevent threats such as loose wire. Be aware of attractions such as a neighboring horse. Remove rubbish and weeds regularly.
Horse general health care and maintenance. First is grooming. Grooming is an important part of daily maintenance for horses. Daily brushing and caring helps improve dirt and debris that can allow bacteria a place to multiply. During grooming, you can also check the overall condition of your horse skin and find sores, infection, bumps, and welts when they first arise. Vigorous carrying is required to remove dirt and horses generally enjoy it. Hair that is bound up should be taken down every 10 to 14 days for brushing and cleaning. Horses can be bathed with equine shampoo, but bath should be kept to a minimum to avoid drying out of skin and coat. Horses should not be bathed when weather temperatures are below freezing, because horses need to be dry to resist the cold. Next is the hoof care. Horse hooves needs to be trimmed every 6 to 8 weeks by a farrier and should be picked daily to remove manure, dirt, and stones, and check for signs of bruising, odor, discoloration, and discharge. These prevent them chipping to be or becoming too long and uncomfortable for your horses. Hoof dressings may be needed, but care should be taken to apply them appropriately. For example, water repellent dressing can be important to keep hooves dry and healthy during wet weather. However, excessive use of emollient dressing can soften the hooves and can lead to problems. Antifungal solution should be applied every 1 to 2 weeks during winter and wet weather to prevent rust. Shoes are needed if the horse is to be ridden on a hard, rocky road. Third, the teeth care. Horse teeth grow continuously. Uneven wear can lead to a sharp point and edges that can cause pain and difficulty in chewing. A horse tooth must be checked once or twice a year and floated by a veterinarian. Dental problems forms painful points to rooting teeth may cause difficulty chewing and quitting, which occurs when food falls out of the mouth. Other signs of dental disease may include foul breath, undigested hay in the stools, or discomfort from the bit or noseband. Dental disease can lead to choke or esophageal blockage, colic, and height loss. Vaccinations and deworming or parasite control. Vaccination recommendations vary based on age, the amount the horse travels, and location. Best to consult in your veterinarian to get what vaccines you should give to your horse. Vaccination is a key component to preventive medicine in horses. Vaccinations are given to stimulate the immune system against infection before exposure to disease. Several vaccines are routinely given to horses as the core defense against serious infectious disease. Foals born to a vaccinated mare are usually protected against most infectious diseases for up to 6 months, so long as the foal consumed the antibody-rich mother's drink known as colostrum within 6 hours of birth. In this case, vaccination should be delayed until maternal immunity has waned. Otherwise, the vaccination should be ineffective. Worms can cause weight loss, poor coat, and colic. It is also best to consult a veterinarian to perform a fecal egg count to test to know the deworming to use throughout the year. It is relevant to minimize your horse exposure to parasites. Proper management entails putting too many horses onto little land, rotating pastures if possible, and removing manure regularly.
Number 7. Signs of illness. When taking care of horses, you should check them regularly for signs of illness, such as during daily feeding and grooming times. General signs of illness include a lack of appetite, diarrhea, coughing and sneezing, discharge from the eyes or nose. Illness can also show as a loss of hair or itchy areas on the skin. Problems with the musculoskeletal system are often seen as lameness, such as not putting weight on a particular leg, reluctance to move, or head bobbing. If your horse shows any of these signs for more than a day or two, a visit with your veterinarian is a good idea. Laminitis. Some horses may develop laminitis. It is a very painful hoof condition. It is a damage and inflammation of the tissue between the hoof and the underlying coffin bone or the distal phalanx or the P3. In some cases, severe damage may develop that is untreatable and require the horse to be put down. Common causes of laminitis are obesity, too much green pasture or grain. What are the clinical signs of laminitis? First is lameness with variable severity in one or more hooves is common. Second, reluctant to move or unwilling to rise or recumbent. Third is shift their weight from one hoof to another or stand with their front feet camped out in front of them and hind feet under their bodies, or what we call sawhorse stance. Fourth is exhibit increased respiratory and heart rates. Fifth is may have systematic disease such as EMS or equine metabolic syndrome and PPID or pituitary pars intermedia dysfunction. How is laminitis treated? Horse may be placed in stall rest with deep bedding and sling support in severe cases. Non-steroidal anti-inflammatory drugs are often used for pain reliefs and to control inflammation, and opiates may be administered in more serious cases. Cold therapy in a form of ice baths or boots are also utilized to minimize inflammation. How can laminitis be prevented? We can prevent laminitis by limiting the access of lash pasture or those high in sugars, especially for high-risk horses, or those with EMS or PPID. Second is minimize sugar and carbohydrates in the diet of horses that have had episodes of laminitis, are insulin resistant, or other high risk. Third, schedule regular farrier care to ensure hooves are properly balanced. Fourth, keep horses at a healthy weight. And lastly, provide support for a limb opposite one that is injured to avoid supporting limb laminitis.
Next is colic in horses. Colic refers to a range of digestive tract or gut problems. Colic can be very painful and can have very serious consequences, including death. Common causes of colic include high-pain grain-based diets or low-forage diets, moldy or tainted feed, abrupt change in feed, parasite infestation, lack of water consumption leading to impaction colics, sun ingestion, stress, and dental problem. Symptoms of colic in horses are lying down or rolling frequently, teeth grinding, restlessness, repeatedly kicking, looking at their flanks or side. So to give the proper treatment for colic, it is very important to determine the cause so it can be corrected. So if you suspect your horse has colic, seek urgent veterinary attention. But here are some treatment that you should do while waiting for your veterinarian. First is observe your horse and monitor their vital signs as well as passing any of feces. Remove access to feed. If there is a blockage, any feed intake will only intensify the problem. Second, let the horse rest as much as possible. It is not necessary to walk the horse unless the horse is rolling and endangering himself or people. Lastly, do not administer any medication without the direction of the attending veterinarian. So how can we prevent this colic in horses? First, feed your horse on a regular schedule even on the weekends. Second, do not make sudden changes to the horse diet. Third, a clean fresh water supply should always be available. Fourth, keep feed boxes and hay racks as well as the feed stock clean and free of molds and dust. Fifth, check teeth frequently for dental problems that may cause chewing issues. Sixth, provide adequate exercise. 7. Feed the appropriate amount of forage, at least 50% of the total diet. Next is keep feed off the ground to avoid sun ingestion, and lastly, practice an effective parasite control program that fits your farm's needs. And that is all for the basic health care in horses.
Now, we discuss the proper handling for horses. Understanding your horse. As prey animals, horses often respond rapidly to disruption in their surroundings. Horses are sensitive to movements, smell, touch, sound, and sights. Horses respond to what they recognize as dangerous object or situation by fleeing, fighting the threat, and bunching together. This is called the flight or fight response. The horse's most common reaction is to startle and flee, often called spooking. To safely work with and handle your horse, you need to understand these key elements of their behavior. Next, we have the haltering. Putting a halter on a horse is easy if the horse has good manners and has been properly trained. Halters of all types may be purchased in various sizes. Most manufacturers list sizes according to breed, age, type, or weight. Once the halter is in place, it should be properly adjusted. This normally is simply adjusting the length of the crown piece. If the noseband is too high, it may rub against the cheek, causing irritation and loss of hair. Halters should not be left on horses that will not be watched. Horses should not be turned out wearing halters. Halters may catch on fences and tree branches. The horse, unable to free itself, panics, usually with serious consequences. Horses use their rear feet to scratch their heads, and loose-fitting halters are an open invitation to get a back foot caught or hung up.
Where to stand. As the handler, you must control your horse movement and create a safe environment for you, the horse, and the people nearby. Never stand directly in front of your horse when leading or backing. Horse cannot sit directly in front of them or behind them. Stand to the near side or left side of the horse, between the head and shoulder, ideally at the throat latch. Standing behind a horse is also unsafe as they have a blind spot there as well. When standing close to the horse, Standing next to the horse's body is the safest. When standing still with the horse, point your feet towards the horse's neck or shoulder. This allowed the handler to maintain eye contact. Facing away from the horse is unsafe. The horse may react to movement before you are aware. Standing close allows you to act immediately if you feel your horse become tensed or frightened. So the fourth one is leading. When leading your horse, always use a lead rope. Do not hold onto the halter and never wrap the lead rope around your hand. Wrapping the excess rope around your hand can be dangerous if the horse shies away from you. Your right hand holds the rope under the horse's head and the other hand will hold the remaining rope. Be sure the excess lead does not drag on the ground where it may become entangled with your legs or the horse's legs. Hold the lead about 6 inches from the halter. When leading, extend your right elbow towards the horse and keep your knuckles on the top of the lead. Horses should not pull or push you when leading, but walk quietly and obediently beside you. If the horse moves too close to you, it should hit your elbow first and then move away from you. Look where you are going and face forward. When leading, apply pressure to the hand closest to the halter in the direction you would like the horse to move. Over time and with training, horses will respond to the handler's body and hand position, more so that pressure applied to the lead. Never pull the horse towards you to turn, always turn the horse away. Follow the horse, moving with them as they turn to prevent the horse from stepping on you. If you encounter problems with your horse, it is recommended to seek help for an experienced equine professional.
For approaching, first is familiarize yourself with basic horse body language. It is very important to be able to tell the difference between a happy, inviting horse and an alarmed or frustrated one. Next is always be aware of where the horses are. Make sure you can see where the horses are and keep watch. Horses can get startled by almost anything. If a horse seems to be running towards you, make sure you don't get trampled. Raise your arms to appear larger and say firm, calm voice, whoa, or get. Third is create an inviting rather than demanding presence before you approach. With horse behavior, there is an idea of pressure and release. Horses are herd animals and will most likely not stand in an area waiting for you to approach them. Simple things such as making eye contact is actually putting pressure on the horse, cueing him to move away from you. The fourth is approach the horse diagonally from the front whenever is possible. The number one rule for approaching horses is to make sure that they know that you are coming. The ICS is by far, if you come at the horse from the front and slightly to the side, to avoid the blind spot right in front of it. If you can, approaching it from the left of the horse is even better. And lastly, if you have to approach from the rear, approach at an angle. This should be avoided by anyone but experienced trainers with knowledge of drive lines. Approaching a horse from a direction other than from front isn't ideal, just like it can be uncomfortable for someone to approach you from the rear. This can be unsettling for the horse. To make the animal as comfortable as possible, come at the horse from an angle, not from directly behind it. The wider the angle, the better. Horses have monocular vision, which means they can use eye separately to see you on their other sides.
Good day everyone, so let's continue the proper handling of the horse. Next in line is the releasing of our horses. I summarized it into 3 steps. The first one is to face the horse towards a wall or fence if available. Second, make the horse stand patiently and when it relaxes, gently remove the halter. And lastly, move away calmly without turning away from the horse. So when we're going to release our horses, especially in the field, it is best to turn it around so it will going to face the gate, or simply let's just going to make it face away from the other horses before we were going to remove the halter, especially if the horse is very tense or excited, and this might lessen the horse's impulse to run off. And horses sometimes bolt sideways or rear and spin when the halter is unfastened if they are anxious to join their herd or just have a lot of pent up energy. And obviously, this is an unsafe habit because the handler can be kicked or run over. So after we make our horses face away from the other horses, let's make the horse stand patiently, and once it relaxes, let's gently remove the halter. And this may also happen when releasing multiple horses at the same time. So in this case, it is better if you're going to make sure that all handlers are prepared to release their horses at the same time. Because if you're going to try to hold one horse back while the other horse is galloping off, it is not a good idea unless if you are a very experienced or an expert in this kind of matter. Because horses, it has the ability to turn quickly and kick out toward the handler. So let's be aware of that. So after we remove the halter, let's just simply move away calmly without turning away from the horse. And that is the right way to release a horse. Next in line is the number 7, which is the helpful hints to remember. First, that do not stand directly behind the horse. Never wrap the lead around your hand or body because there is a possibility that if the horse will going to run over, you will get dragged and that will be dangerous. Next is that teach your horse to be patient when being turned loose and do not allow the lead to drag on the ground because there is a possibility that it will get tangled on our foot, especially and on the horse's leg, and that might lead to any accidents. Next is that never stand, lead, or backstanding directly in front of the horse. And discourage bolting, never open the gate and let the horse run through, especially the untrained one. So let's remember that horses respond to their surroundings. Basic safety practices are essential in providing a safe and enjoyable experience for both us humans and our horses. Safe ground handling is important no matter what breed, type, or age of horses you work with. So that is the end of our topic discussion. I hope that everyone got to learn something. Have a great day and God bless us all. Thank you.